Welcome, everyone. We had such a fantastic second Neuro-Oncology International Conference in collaboration between the Muhimbili Orthopaedic Institute and the Colorado University from USA. It was such a fantastic, spectacular 5-day scientific conference. And together with me here are Dr. Niceforius Rutabasibwa from Muhimbili Orthopaedic Institute, Dr. Ryan, and Professor Kevin Lilehai. So I would like to ask your experience during this second Neuro-Oncology. Give us briefly what you experienced when you came to Tanzania and during this conference. And maybe you'd like to also inspire the upcoming aspiring neurosurgeons who are in East Africa, Tanzania, and Africa as a whole.
Well, thank you very much. First thing I want to say is that this conference has been terrific, that we've had a wonderful time. Dr. Ruta, Dr. Ormond had arranged the program. It's a terrific program. This is the second year that we've done the conference, and I think it's getting better. Okay. We're looking forward to the third conference, hopefully. And I have had the pleasure of coming to Tanzania now for over 15 years. Wow. And more recently in Dar es Salaam. But when I came, there was 5 neurosurgeons in the whole country. And I think the Muhimbili Moi has really set the pace of getting more neurosurgeons. So last count, we were told 25 to 30 neurosurgeons now in Tanzania. And that's terrific. So the message that I would send is we need more neurosurgeons in Tanzania, but the programs are here, and it's been a joy for us at University of Colorado to work with the neurosurgery department at Moi.
Thank you so much, Professor. So back to you, Dr. Rutabasibwa. We understand you're a neurosurgeon at Muhimbili Orthopaedic Institute, Moi. So what was the experience like during this Neuro-Oncology conference?
Yeah, thank you very much. My experience was this conference has been successful. And as Professor Hai has said, we started like 2 people, 3 people. And after that, we had to organize the meeting with Dr. Ray and the professor. And then it has been improving now and then. I can say the 2019 meeting which we had, which was comprehensive, but we have added on other topics, which with the breakup of the nursing sessions, so it is being much more inclusive. It is much more inclusive, and this is the thing which we want, that not only doctors, but we have some other people who help the doctors to work, and that is the nurses, people in ICU, people in the operating rooms, and all of them have been included in the course, and I think it is a big step for us.
This is the second conference that we have held here, but what's your experience like in taking care of neuro-oncological patients back in Colorado, and also the experience you had here during the conference, listening to other speakers? So can you share that with us?
Yes, so I'm a brain tumor surgeon at the University of Colorado, so we subspecialize there. So this is my primary practice, and so I have a lot of interaction there with neuro-oncologic patients. And part of what we do there extensively is emphasize the importance of multidisciplinary care. So the care of the neuro-oncologic patient goes beyond neurosurgery and includes really all the neurological specialties, including neuropathology, neuroradiology, neuro-oncology, medical neuro-oncology, and radiation oncology, as well as then nursing care and various physiotherapy, for example, and occupational and speech therapy to help patients recover from some of their injuries that come on either from the tumor itself or from treatment, chemotherapy, radiation, and even from surgery as they work to recover. And we try to improve and balance quality of life with extending life expectancy, despite the diseases that affect the neuro-oncologic patient. And these are all the same issues that MOI has to deal with when they have a patient come in with a brain or spine tumor. And it's been great to see what is being done here and what the future will bring as we improve knowledge base and access to neuro-oncologic services throughout the country.
Thank you. So, Professor, I understand you say that there's an upcoming third one, and I understand, Dr. Tabasibo, we're going to have a third neuro-oncology conference. So, what are the things you'd like to say that it's going to be promising that they're going to be there in the third Neuro-Oncology conference that is going to be held soon, I believe. I don't believe there's going to be another pandemic, so I believe it's going to be as soon as maybe next year. Is it?
So we hope to do it within 12 to 18 months. One of the things that was done this year that we didn't do the first one is have a more robust program for our nurses. And I think that's going to be an emphasis of this next conference, is getting more of our nursing colleagues involved, not only our intensive care nurses, but some of our outpatient nurses, radiology, nursing, and the rest. So I think that's going to be at least a big part of our next conference.
And Dr. Rutabasibo, what is it that we're expecting on the doctor's side in the upcoming third Neuro-Oncology conference?
Thank you. We intended to expand our scope, that the doctors should not come from the nearby regions, and that we are going to just to program and then to make sure that everyone is aware that there will be a neuro-oncology symposium, which is very educative, not only for neurosurgeons. As you know, we don't have so many neurosurgeons, but you can have other doctors who can take care of the neurosurgical patients, the first aid, and when to know that there is a neuro-oncological problem, and when they know that this patient has to be referred. So we are going to disseminate information to not only neurosurgeons, but other people who we think they meet the neuro-oncological patients, and then they should know that this patient requires a neurosurgical attention. That's what we are going to do. Thank you.
What do we expect in the upcoming third Neuro-Oncology conference from you, maybe specifically?
Yeah, so our goal is to, again, expand the scientific offerings, both on the didactic side, so teaching, as well as on the practical side. So working to for the physicians, both in Colorado as well as here in the East Africa region, to improve our neuro-oncologic databases and our understanding of the care that is happening for our patients, and how to improve the quality of the care that our patients receive, and to bring that scientific knowledge to the conference, to the symposium, and work and interface together in collaboration for how to learn further detail about what is going on with our patients, and then work through how, in a multidisciplinary fashion, how to improve the care of these patients.
If we get it right, this is not just neurosurgical or just the nurses, but you kept, every one of you is emphasizing on multidisciplinary. So the pathologists, everyone is supposed to be involved in it. The neuroradiologists, everyone is supposed to take care of these patients, from the emergency, outpatient, in the ward, and post the surgery. So I believe that the third one, you don't want to miss it. Professor is going to be there. Dr. Ryan is going to be there. Dr. Rutabasibo is going to be there. I have to be there. I will be there. So you don't want to miss it. And just the fact that every headache, people think it's malaria. It is not. They're saying you need to go to the hospital, get an early diagnosis. It might be a meningioma, or it might be malaria, as you think it is. So we believe that the Tanzanians are in good hands right now, and all the other citizens, because the care is going to go much more broader until to the peripheral. So see you next year.